Breakfast, the most important meal of the day. How many times have we heard that one? It is, in fact, true. I'm Gord Marklew, and with me today, Dr. Elaine Chin, founder of the Bespoke Wellness Group. Now, you have said to me in conversations we've had on the issue that you have to know your numbers. What do you mean by that?
Well, we need to understand your numbers in order for us to detoxify you, de-stress you, so that you can end up with a healthier weight and better sleep. So let's talk about the first test. We have a blood spot kit, and the things that I think people should know is their cholesterol profile, whether they're at cardiovascular risk, know their A1C and their blood sugar, so to know that if they're diabetic or pre-diabetic. And also you can understand your cortisol, which is your stress response hormone. So just simply with a finger prick, we can get all this information to know your numbers and know what to do with it.
So it's getting a handle on your health. Now,
Exactly.
Here's another one you've got, saliva.
Yes, so just by spitting in a test tube and shipping it off to the lab, you can actually understand a lot of your hormones. And one of them could be cortisol, which is your stress response hormone. And if you collect it throughout the day, you actually can create your cortisol curve so that you know if you are overstressed or burned out. And accordingly, we can treat you. And therefore, with this kit, we can also understand other hormone profiles, such as your estrogen, your testosterone, progesterone, DHA, all hormones that decrease as we age. And then you can decide if hormone replacement is right for you as an anti-aging strategy.
No series of tests is complete without a urine test, correct?
Right. Well, we often think of a urine test as having to pee in a bottle. But in this situation, all you need to do is pee on a card over 4 sessions in a day. And what we can measure is something amazing, which is your neurotransmitters, which is really your brain chemicals. And for the first time in my career, I can tell you if you're more at risk for depression, anxiety, panic disorders, or just needing to feel not satisfied. So the hormones involved are serotonin, GABA, dopamine, epinephrine or norepinephrine, and just simply peeing on a piece of paper.
So once you've got all these series of tests done, you'll know the book on someone and the best way to advise them, correct?
Yeah, because people always say, well, what do I do? Do I need to take this or do that? I say, I don't know. You just need to know your numbers, and from there, as a team of health professionals, both myself as a medical doctor and the naturopathic doctor can manipulate these numbers to give you a better sleep, healthier weight, and anti-aging.
Good information. Thank you. Thanks for your time today. If you're looking for more information on the items we've been discussing, go to thebespoke.group.